Hello and welcome. My name is Dora Ann. I will be your presenter today. I work with Blue Cross and Blue Shield, Texas. I'm a community relations specialist, and this presentation is Live Your Blue Life Medicare Overview. The ABCs of Medicare. Medicare has four parts. We'll start off with Medicare Part A. This is your hospital insurance. It's usually free and automatic at the age of 65. It covers inpatient hospital care, skilled nursing facility care, home health care, hospice. Basically, Part A pays for your room and board when you are in the hospital. Medicare Part B. This is your medical insurance, and it helps cover services from your doctors and other healthcare providers, outpatient care, durable medical equipment, and preventative services. Part B pays for your doctors and medical equipment that they use. If you don't enroll in Part B when you're first eligible for Medicare, you may have to pay a penalty later. Medicare Part C. This is your Medicare Advantage plans. They're run by private insurance company. This is not part of original Medicare Parts A and B, and they must at least cover what Medicare Part A and B covered, and they may or may not cover prescription drugs along with other benefits. Medicare Part D is prescription drug coverage. This helps cover outpatient costs of prescription drugs. They're administered by private insurance companies that contract with Medicare. If you don't enroll in Part D when you're first eligible for Medicare, you may have to pay a penalty later. And then this slide here, this is your pathway to Medicare coverage, or at least there's one way to get your Medicare coverage. You can have original Medicare with the Part A, hospital insurance, and Part B, medical insurance. And if you need prescription drug coverage, you can enroll in Part D for prescription coverage. And if you need to add supplement care, you can enroll with the Medicare Supplement Insurance Plan. When you go this pathway, it's going to allow you a lot of freedom because you're going with original Medicare, so you have the freedom to pick your own doctors and hospitals. You can also get your Medicare coverage by enrolling in a Medicare Advantage plan, which is the Part C Medicare. The Part C combines Part A, hospital coverage, Part B, medical coverage, and it usually includes the Part D for your prescriptions. If you enroll in a Medicare Advantage plan that does not include the Part D, you can enroll in a standalone Part D plan for prescription drug coverage. And when you have a Medicare Advantage plan, you cannot have a supplement Medicare plan. Again, if you have a Medicare Advantage plan, you cannot have a Medicare Supplement Insurance Plan. Now, these Medicare Advantage plans are managed by plans that are administered by private insurance companies. You do have a certain network of providers, and you usually need referrals to see specialists. They don't travel with you. The upside is that they're usually low cost depending on the type of plan that you choose, and they normally include drug coverage. Are you eligible for Medicare? To be eligible, you have to be a U.S. resident, including persons aged 65 or older, and eligible for benefits under Social Security or the Railroad Retirement System. Individuals who have been receiving Social Security or disability for 24 months or longer. It's for persons that receive regular dialysis or who have received a kidney transplant due to end-stage renal disease. It's for persons that have been diagnosed with ALS, also known as Lou Gehrig's disease. Enrolling in Medicare. If you're turning 65 and you're already receiving Social Security retirement benefits or railroad retirement benefits, you will automatically be enrolled in Medicare Parts A and B. And if you're turning 65 and you're not receiving Social Security retirement benefits or railroad retirement benefits, you will need to actively enroll in Medicare by contacting Social Security or enrolling at medicare.gov. You can do this by phone, online, or in person. Does everyone need both Medicare Parts A and B? Yes, everyone over 65 and no longer working needs both Medicare Part A and B as a primary source of coverage. However, some people may delay in enrolling in Part B if they or their spouse are still working for a company with 20 or more employees and are covered with the employer's insurance group. Original Medicare is primary care. Now, Parts A and B are considered original Medicare. However, Medicare was not designed to cover all costs. You're responsible for deductibles and copays and coinsurance amounts that are not covered by original Medicare. Options for additional coverage with original Medicare are group retiree health coverage, supplement insurance plans, also known as Medigap plans, prescription drug plans, which is the Medicare Part D. And what if I'm still working after the age of 65? If you're eligible, you can sign up for Medicare Part A at age 65. If your employer-sponsored group benefits are good or better than Medicare at a comparable cost, you can consider delaying Medicare Part B and Part D enrollment. There are no late enrollment penalties as long as you or your spouse are working and covered under an employer-sponsored group benefit. Now, if you have a health savings account, you may want to ask your personal office or insurance company how signing up for Medicare will affect you. What happens to my spouse's coverage if I retire? Well, you do have available options. Some retirement plans will cover a younger spouse until they are Medicare eligible. You may be able to join a spouse's group retirement plan, COBRA. You can consider individual coverage, individual major medical plans for those that are under age 65, and individual Medicare supplement plans for those over the age of 65. And then Medicare Part A will provide coverage for your hospital stays, skilled nursing facility stays, home health care, hospice, and blood. And your 2020 deductibles and copayments. For days 1 through 60, you pay $1,408 deductible per benefit period. Medicare will pay all of that except the $1,408 deductible per benefit period. A benefit period that begins the day that you're admitted into a hospital or a skilled nursing facility, and it will end when you have not received inpatient hospital or Medicare covered skilled care in the skilled nursing facility for 60 consecutive days. The benefit period is not tied to a calendar year. And then day 61 through 90, you have a $352 copay per day that you're responsible for. Medicare will pay all except for that copayment of $352. And if you have an extended hospital stay, 61 through 90, or long-term, I should say, a long-term stay, days 61 through 90, you have a $352 copayment per day. Medicare will pay all except that $352 a day. And days 91 to 150, if you have an extended hospital stay past those 90 days, you're responsible for $704 copayment per day. Medicare pays all but the $704 copayment per day. And then days 151 on up, you pay all expenses. Medicare has no coverage after 151 plus days. 2020 copayment, skilled nursing facilities. Days 1 through 20, you have zero out of pocket. Medicare pays all approved amounts. Days 21 through 100, you have $176 copayment per day. Medicare pays all but that $176 copayment. And days 101 plus, you pay all expenses. There's no coverage that Medicare pays. Other covered services, you have home health care services, hospice care, and blood. Medicare Part B. The Part B standard monthly premium for 2020 is $144.60. This is going to be based on when you enroll and your annual household income. This premium is commonly paid through Social Security withholdings. Medicare Part B will provide coverage for your doctor's care, surgery, outpatient care, lab tests and x-rays, home health care, durable medical equipment, and other medically necessary services and supplies, preventative benefits, and mental health services. And 2020 deductibles and coinsurance. Your expenses under original Medicare Part B, you have your annual deductible of $198, 20% of Medicare approved amounts, and excess charge of no more than 15% of the Medicare approved amounts for physicians who do not accept Medicare assignment. This excess charges, they happen when you see a provider who accepts Medicare patients, but they don't accept Medicare as payment in full. This is also called Medicare assignment. And then we're going to talk about Medicare excess charges, outpatient assignment example. So if you see a doctor that accepts assignment and say the doctor's fee is $100, Medicare approves $80 of that, Medicare would pay 80% of that $80, and so the total that Medicare would pay would be $64. And the patient would pay 20% of that $80, which comes out to $16. And the $20 excess charge is waived. And this is when you see a doctor that accepts assignment. If you see a doctor that does not accept assignment, and we have the same example, say the doctor's fee is $100 and Medicare approves $80, Medicare would pay 80% of that $80 for a total of $64. The patient would pay the 20% of that $80 approved amount. So their total would be $16 out of pocket. And they would also have to pay the excess charge up to 15% of that $80, which comes out to $12. So they would pay $16 plus $12 excess charge. So the total that the patient would be billed is $28. Note, this example assumes the Part B deductible has been met. And now we're going to talk about Medicare Part B enrollment phases. There's the initial enrollment period. Who's eligible? It's for those that are turning 65. When is it? You have a 7-month window. You're able to enroll 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. And what if I miss it? Well, there's a 10% penalty for each year you're late in enrolling. There's also a general enrollment period. Who's eligible? Those who miss the initial enrollment period. When is it? It starts January 1st through March 31st of each year for coverage that begins July the 1st. And what if I miss it? There's that 10% penalty for each year you're late in enrolling. Another Medicare Part B enrollment phase is the special enrollment period. Who's eligible? It's for those who have employer or union benefits prior Part B coverage. When is it? It's 8 months starting on the date that the employment ends. And what if I miss it? You must enroll while employed or within the 8th month window period. Original Medicare Part B preventative benefits. You can ask your doctor about Medicare covered preventative tests and screenings that may be available to you. For preventative services, there's the annual Part B deductible is waived. Additionally, if your physician accepts Medicare assignment, they will accept Medicare payment as payment in full for many of the preventative services. You can talk to your doctor about Welcome to Medicare Initiative preventative physical exams, annual Medicare wellness exams, diabetes screenings. There's several screenings you can talk to your doctor about. There's mammograms, obesity screenings, tobacco use cessation counseling, and others. And then Medicare Part B exclusion. Now we're going to talk about what Medicare does not cover. It's not going to cover the following medical expenses: dental, routine eye exams, eyewear, hearing aids, hearing tests, cosmetic surgery, healthcare outside the United States. And then original Medicare Parts A and B 2020 expenses. This is what you're responsible to pay. There's the Medicare Part A inpatient deductible per benefit period of $1,408. You have unlimited excess charges that you're responsible for. You have the Medicare Part B deductible of $198 and 20% Medicare Part B coinsurance unlimited. There's hospital copayments, skilled nursing facility copayments, and hospice inpatient respite care, 5% coinsurance. Medicare Part C basics. Medicare Advantage plans are offered by private insurance companies. They bundle Part A and B with other benefits, and they usually include Medicare Part D for your prescription coverage. So you can think of these plans as all-in-one plan. Medicare Advantage plans are not Medicare supplement insurance plans. Medicare Part C coverage. Some Medicare Advantage plans offer extra coverage that's not available through original Medicaid, such as vision, dental coverage, and hearing tests. Co-payments and coinsurance can vary according to each Medicare Advantage plan. All Medicare Advantage plans have a maximum out-of-pocket limit. Many Medicare Advantage plans include prescription drug coverage, and you can review your plan options at www.medicare.gov. Now, Medicare Part C definitions. There's HMOs, which are health maintenance organizations. With these plans, you use in-network providers. You need referrals from a primary care provider to see a specialist. There's also PPOs. These are preferred provider organizations. These plans are, in this plan, you can go out of network for care, but in-network providers will cost you less. There's POS plans. This is point of service. This is a hybrid of an HMO and a PPO. And like an HMO, you have a primary care provider, but like a PPO, you may go outside of the provider network for healthcare services. There's also PFFS. This is private fee for service. The plan determines how much it will pay doctors and other healthcare providers and hospitals. You can go to any Medicare approved doctor, other healthcare providers or hospitals that accepts the plan's payment terms and agrees to treat you. Not all providers will. And then Medicare Part D. This was designed to make your prescriptions more affordable. In order to get Medicare Part D, you must enroll in one of the approved plans that's offered within your state of residence. Part D coverage is available as a standalone plan, or it's often bundled into a Medicare Advantage plan. Part D formularies can vary from plan to plan. Now we're going to talk about the Medicare Part D phases. There are 4 Part D phases. You have your annual deductible of $435. This is the amount that you spend out of pocket on medications before the insurance company begins to also pay towards them. The maximum deductible any plan can have is $435 in 2020. There's also the initial coverage limit of $4,020. Once you've met your deductible, you're now in the initial coverage phase, where you now share in the cost of medications, copays or coinsurance with the insurance company. And then gap coverage, or coverage gap that is, for 2020, it's $4,020 to $6,350. This is sometimes referred to as the donut hole. Once you and your plan reach $4,020 in drug costs in 2020, you now enter into what's called the coverage gap. The cost has gone down from 2006 from 100% to where now you pay up to 25%. 75% is paid by the drug plan. Plans may cover some drugs in the coverage gap until you reach $6,350 in true out-of-pocket costs, also known as TROOP. Catastrophic coverage begins at $6,350. So once you reach this phase, your Part D carrier must pay 95% of all the costs of your covered medications. You pay only 5% or a small copayment, whichever is more, for the rest of the year. Troop consists of member payments. It includes your deductibles, co-pays or co-insurance, and costs for coverage drugs and the coverage gap. Troop does not include money spent by the insurer. When this total exceeds $6,350, you will have entered into the catastrophic coverage. And now we'll talk about Medicare Part D enrollment basis. There's the initial enrollment period. Who's eligible? It's for those turning 65. When is it? Well, you can enroll 3 months prior to the month of your 65th birthday, the month of your 61st birthday, and then up to 3 months after the month of your 65th birthday. And if you're disabled, you can call customer service for more information. And then the annual enrollment period, or AEP, for your Medicare Part D, it begins October 15th through December the 7th. What is it? Well, this is an annual opportunity that you have to switch plans or enroll for the first time. If you like your plan, you do nothing, you stay in the same Part D plan. Special enrollment period. When is it? This is triggered by specific events. At this time, you can make changes to your prescription drug coverage when certain events happen in your life, like you move to a new address that isn't in the planned service area, or if you're entering or leaving a long-term care facility, or if you have a non-renewal termination of a Medicare Advantage plan with Part D coverage. So those are some examples of when you can change or use the special enrollment period. What should you know about Medicare Part D? You want to check to see if you have credible coverage through a group plan. You must be enrolled in Medicare Part A and or B. You can enroll during specific times of the year. Medicare Part D beneficiaries with higher income may pay higher premiums. And then examples of credible coverage. There is various group health plan retiree coverage, state pharmacy assistance program, Veterans Affairs coverage, military coverage, including TRICARE. And credible coverage, that's expected to pay on average at least as much as Medicare standard prescription drug coverage. And then we already talked about the examples of credible coverage. What is the Part D late enrollment penalty? Higher premiums. If you enroll after your initial enrollment period, unless you had credible coverage, they assessed 1% of the Medicare base beneficiary premium for every month in which you're eligible to enroll but didn't. No, you will not be charged a late enrollment penalty if your situation changes and you need to buy Part D, as long as you had credible coverage and you applied within 63 days of your credible coverage terminating. How do I apply for extra help? People with limited income may qualify for up to 100% of drug costs, including monthly premiums, annual deductibles, co-pays, and co-insurance. Items that are not covered by extra coverage would be the coverage gap, late enrollment penalties. To see if you qualify, please contact Medicare or Social Security. Medicare savings programs. You may qualify for assistance from your state to pay for your Medicare premiums. In some cases, Medicare savings programs may also pay for Medicare Part A, which is your hospital insurance, and Medicare Part B, which is your medical insurance. They can help with deductibles, co-insurance, and co-payments. Qualified Medicare beneficiaries or QMB program. Specific low-income Medicare beneficiaries or the SLMB program. And please call your state Medicaid office to see if you qualify. And you do want to note that if you qualify for one of the above programs, you automatically qualify to get extra help paying for Medicare prescription drug coverage. Then I have some resources here on this slide that are available to you. Medicare resources, you can go to www.medicare.gov. You can also call 1-800-MEDICARE. They're available 24 hours a day, 7 days a week. If If you need to contact Social Security, you can go to their website, www.ssa.gov, or you can call their toll-free number, and they're available Monday through Friday from 7 a.m. to 7 p.m. And then this slide here is a disclaimer letting you know that Blue Cross and Blue Shield of Texas complies with the applicable federal civil rights laws and does not discriminate on the basis of race, color, national origin, age, disability, or sex. And Blue Cross and Blue Shield of Texas provides free aids and services to people with disabilities to communicate effectively with us. We have qualified sign language interpreters, written information in other formats. And then here are more disclaimers. If you believe that Blue Cross and Blue Shield of Texas has failed to provide these services or discriminated in any other way on the basis of race, color, national origin, age, disability, or sex, you can file a grievance with the Civil Rights Coordinator, and we have the address here and telephone number where you can contact them, or where you can contact them by email. You can also file a civil rights complaint with the U.S. Department of Health and Human Services Office for Civil Rights. You can do this electronically. It has their web portal here, and it has a physical address where you can write a letter. You can call a toll-free number. There's also a website here for complaint forms that are available to you. And this slide here has additional information. If English is not your primary language, these are their languages that are available to you. And here are additional languages that this information is available in. So we've come to the end of our presentation, Live Your Blue Life. Should you have any questions, we can schedule a one-on-one meeting. And once again, thank you. Have a great day.